Anthika, and I'm a Go Red for Women ambassador in Sacramento, California. I'm here with my mom and fellow Go Red for Women ambassador, Dr. Ritu Sharma, a cardiologist with Sutter Health Heart and Vascular Institute. We are big on self-care in our house. Why is self-care and supporting your emotional health so important? And how can it help your heart health?
Self-care sets the foundation for your personal well-being. It helps you deal with challenges and stressors outside. Your emotional health depends on this. Your physical health is directly related to your emotional health. Your heart health is directly related to this as well.
Being a teen girl can be stressful. How does stress affect the body, and what are some ways that teens can manage their stress and support their heart health?
Yes, being a teen girl can be very stressful. You're going through a lot of changes in your body, and your hormones are fluctuating as well. Stress has direct and indirect effects on your body. Stress causes hormones to be released, such as epinephrine, which is your fight and flight hormone, and cortisol, which is the stress hormone. These hormones can actually lead to some common risk factors for heart disease, such as high blood pressure and diabetes, and also can lead to cardiac events, such as heart attacks. This underscores the importance of stress management. So I encourage you to take measures to decrease your stress level, such as doing activities like sports, walking your dog, playing your favorite instrument, going for a jog, or doing just whatever relaxes you.
Many people think heart disease is just something that happens to older men, but heart attacks are on the rise within younger women. Why is this, and what can young women do to reduce their risk?
Yes, heart disease was traditionally thought of as a man's disease. Then we realized that postmenopausal women, those over 55, were dying more often than their male counterparts. Yet now we're realizing that women, even before menopause, are at risk for cardiac events. We are just beginning to understand why this is. Some is just the same traditional risk factors that we know about. However, we're finding another variant of heart disease in women called spontaneous coronary artery dissection, or SCAD, that affects women that are younger. This was somewhat of a puzzle for us because a lot of these women did not have the traditional risk factors. We are now learning that stress really can play a big role, and this is physical and emotional stress, can really play a big role in their events. This is why it's even more important for self-care starting in the early years. Managing stress can help reduce cardiac events in this age group.
The American Heart Association's Go Red for Women movement is all about living fierce and supporting women's heart and brain health. How can women fit in time for self-care and supporting their cardiovascular health into their already busy lives?
I think for me, it's not about adding something to your day. This should be a part of your day, just like going to work, taking a shower, or brushing your teeth. Exercise and time to yourself is vital to your mental health. I've already mentioned why mental health is so important for heart health. It's also important to remember that many of us have chronic medical conditions that increase our risk for anxiety and depression. Anxiety and depression can get in the way of heart health. We know that people who are depressed or anxious are not inclined to exercise or may start smoking or drinking to cope. Yes, so not only can poor mental health lead to heart disease, but causing risk factors such as high blood pressure and diabetes, but it also causes what I call the poor choice risk factors, such as sedentary lifestyle and smoking. That's the head-heart paradigm, that anxiety can lead to heart disease, and heart disease can lead to more anxiety and depression, causing a vicious cycle of poor cardiac health. This cycle can be broken only by self-care and a positive attitude and inclination towards exercise. You release natural happy hormones called endorphins that will help decrease anxiety and depression when you exercise and meditate. Not only will you start feeling good, but so will your heart.
Thank you, Mom, for joining me to help raise awareness about the importance of self-care and supporting women's heart health, and for all you do to help heart patients.
Thank you.